Hello and welcome to today's Here's to Your Health podcast. I'm Brandy Ruskell, Marketing and Development Coordinator at Crawford County Memorial Hospital. And on our podcast today, I have Brooke Schwery. Brooke is a care transitions and utilization review nurse here at CCMH. So welcome, Brooke.
Welcome, thank you.
So today, Brooke, I want to talk about our swing bed program. Swing bed program. So up until recently, I had no idea what this was or that we even did it here. So can you explain a little bit about swing bed?
So we've always had it. We just never really advertised it, or I feel like had very many skilled patients here with us. So basically once you're in the hospital and you are stable and you just need some sort of rehab or antibiotics or anything that's going to extend your stay, but you're still medically stable, you could potentially qualify for a skilled level of stay. So basically at our hospital, you have the same room, same nurses, same familiar faces. You just are only here for rehab, essentially, whether it be antibiotic or physical or occupational or speech.
So is this an option for people that might be looking at going into a nursing home compared to being able to go home?
This would be like your transition, your in-between. So I'm not quite safe enough to go home because I need some more rehab, but I really don't want to go to a nursing home because of the stigma of nursing homes. So this is kind of your in-between with hopes to get you back home and get you feel comfortable and safe enough.
Got it. And what are some of the benefits of a swing bed program?
So there's a couple different benefits when you look at it. So if you say you're hospitalized in the city, but you are from the Denison area and you want to be back home closer to friends and family, this allows you to come home where you're closer to home, but still get the care needed without having to move multiple more times or stay in the city. So you can transition here with us, get your 2-3 weeks of therapy that you need till you're comfortable, safe enough, strong enough to get back home. And then we hopefully, with the end goal being you get back home.
Got it. And let's talk about, everybody wants to know about cost. So are there qualifications?
That's where it gets a little bit tricky. It depends on your insurance. So most insurances might want you to have like 3 acute nights in a hospital. Some say 2, most say 3. And then most of the time you just need an authorization, so that you basically have to have your insurance quote unquote approve it, so that they know that it's justifiable on their end. Gotcha. To pay for it. And then from there, once you are approved and you qualify, there usually might be like a set amount of days where it's completely paid for. And then once you use that up, you might have a copay after that, but if you have a secondary insurance, you might not. It's kind of fuzzy.
Okay. So do people need to be talking to their healthcare providers about this? How do we get the word out that we offer this service?
Yeah, so if you say you're planning to have a hip surgery, a leg surgery, you break a bone and you have to have surgery to get it fixed, you have to think about that next step. You have to plan ahead. So if you tell them that, hey, I heard Denison does skilled therapy, is this a possibility? Have them reach out to us and have them see if this is something that we qualify for, or you qualify for. You can always call your insurance company and see if that's an option that they offer, and just kind of go from there, especially.
So if someone is interested in the swing bed program, or they think it might be a good fit for them after surgery, who do they contact?
So typically you have like a social worker or a utilization review nurse. If you're here, it's me. But if you're in the city, you'll have like a social worker or a case manager. You can say something to them, and they might already ask you, they might bring it up to you even. So basically just have them either get a hold of someone at the hospital here, or just send their referral and we can hopefully get you here.
Awesome. So you've mentioned healthcare professionals like yourself, and then there are therapy staff, there are doctors, there are nurses. How do they all fit together?
So we all kind of communicate, and once a week we do have a little conference to discuss progress and goals and the end goal is almost always to get them back to whatever their previous living environment was. So regardless if that's home with your spouse or if you are in assisted living or independent living, the goal is to get you back to whatever you were doing before. So if you're having a hip done or a knee done and you're gonna need a therapy, then we all work together, and therapy will kind of go to your doctor and say, hey, they're really doing good, but they're having a lot of pain. Can we increase your pain? So there's a lot of communication between all of the working parties together, which is what's nice about that care conference, that we meet once a week. All of the other people that are involved in your care, we all get together and meet and have a little meeting between the patient, the patient's family, whoever wants to be there, and just kind of chat it and touch base and go from there.
So the patient's family can be involved in that?
Yep. Patient's family is always encouraged to be involved in the rehab process.
Awesome. Okay, well, I think that's all we had to cover today, Brooke, unless there's anything you want to add.
Yeah, no, so if this is something that you think you're interested in, or you know you're due for a knee replacement, hip replacement, and this is something that spikes your interest, definitely reach out and give us a call.
Okay. Well, thank you very much. Again, I've been talking with Brooke Schwery, Care Transitions and Utilization Review Nurse here at the hospital. We've been talking about the swing bed program, and thanks for listening.